I'm going to have a conversation with Sophia Hensley, an 11-year-old patient who comes to the outpatient center with a 2-year history of frequent upper respiratory infections, joint pain, headaches, and mouth ulcers. And her family is frustrated because they have not been able to make a definitive diagnosis on her. So my task is to do an assessment and a health and social history on Sophia. So we're going to start this task. Hi, Sophia. I'm Laura. I'm going to be your nurse today. How are you?
Hey, I'm okay, I guess. Just feeling kind of blah.
That's too bad. Let's see if we can figure out what's going on.
Yeah, I've been feeling pretty crummy lately. My head hurts, my knees hurt, and I've got this weird rash on my face.
Okay, before I start asking you some specific questions about all this, can you tell me your name and your date of birth?
Oh, my name's Sophia Hensley, and my birthday's September 30th, 2012.
Perfect. Also, would you just tell me if you have any allergies to any medications?
No, I don't think so. I'm not sure about all those fancy pills, but I don't think I'm allergic to anything.
Perfect. That's great. Okay, I want to start out by asking about this rash on your face because I can see the red rash. It doesn't look like anything is raised up on there, but does it itch or does it hurt?
It kind of itches sometimes, but mostly it just burns. Like when you get a sunburn, but not as bad.
Okay, great. Is this the first time you've ever had it?
Yeah, I think so. It's never happened before, but I'm not totally sure.
Okay, that's good. Now, will you tell me a little bit about your knees? You said that they were hurting, and I can see that they're kind of puffy. Um, if 0 was no pain and 10 is the worst pain you've ever felt, how bad are your knees hurting right now?
Probably around a 3. Not terrible, but still kinda uncomfortable.
Okay. Does it hurt you when you walk?
Yeah, it does. I'm limping a bit because of it.
Okay. And is there anything that makes the pain worse or better? What do you do to make it feel better?
Resting helps. When I sit down, it feels better. But when I stand up, it starts hurting again.
Okay. I understand that. My knees hurt too, and I feel bad when I walk too.
Thanks. I hope yours feel better soon.
Thank you. You're so sweet.
Thanks.
Okay. Now, I also want to ask you about your head because you said that your head was hurting also. Is that correct?
Yeah, my head hurts too. It's not as bad as my knees, but it's still pretty uncomfortable.
Okay, so can you tell me what does the pain feel like in your head?
More of a pressure than anything else, like someone squeezing my head.
Oh, yuck. That must be really uncomfortable. I'm sorry about that.
Yeah, it's not fun.
So, using that same 0 to 10 scale that we talked about a minute ago, how much pain or how bad is the pain in your head right now?
It's probably a 2. Not too bad, but still noticeable.
Okay, and does it come and go?
Yeah, it comes and goes. Sometimes it's worse, sometimes it's better.
Okay, and just like I asked you with your knees, what makes it worse and what makes it better?
Standing up makes it worse. Sitting down helps. Taking Tylenol helps too.
Perfect. Thank you so much. Now, I want to ask you, um, I see that you've had a history of having a lot of upper respiratory infections. Have you ever been in the hospital because of those infections?
No, I haven't been in the hospital.
Not not ever been in the hospital, not for anything at all?
No, I haven't been in the hospital.
Okay, so you've never even had surgery, huh?
No, I haven't had surgery either.
Okay, great. Thank you. Do you know if anybody in your family, like your parents or grandparents, have they ever had any problems with their heart or any problems with breathing?
Nah, I don't think so. My family's pretty healthy, actually.
Okay, great. I'm going to talk to your mom a little bit more later about specific family history.
Okay.
Um, so has anybody talked to you at all about, do you know about like some of the symptoms that you're having? If anybody in your family has had symptoms similar to what you're having, like the rash, the knee pain, the headaches, things like that.
Uh, I don't think so. I mean, my sister gets headaches sometimes, but I don't think she has a rash or anything.
Okay, thank you. That's good to know. There are some different diseases that have that can cause some of the symptoms you're having, and we're going to talk about some of those things in a little bit more in depth, okay? What? Is that bad?
Okay.
Okay, can you tell me about who you live with at home?
Well, I live with my sister and my mom and dad. We have a pet rabbit too. His name's.
That's a really cute name. I love that. What grade are you in at school? I gotta end it though because I'm running out of time.
Sixth grade.
Awesome. And what do you like to do for fun?
I like hanging out with my friends, especially when we listen to Taylor Swift together.
Oh my goodness, you're a Swiftie. Awesome.
Yeah, I love Taylor Swift. She's awesome.
Okay, cool. I'm going to go and I'm going to talk to the doctor about some of the things that you've told me, and I'm going to talk to your mom so I can get a little bit more information. And then I'm going to come back and I'm going to talk to you about some things too.
Okay.
Is there anything you need from me before I go?
Could you bring me some water when you come back?
Absolutely.
Thanks. I'll be waiting here.
Okay, I'll see you in just a few more minutes, okay?
Okay.
So real quickly, I just want to show you the grading rubric and how I did. I needed to pass 5 sections. I actually passed 6, but there are some specific areas that I didn't pass within here, but that gives me that feedback. So like I didn't get consent. I didn't actively ask questions about the patient's thoughts or issues, or provide explanations. I did say that I was going to come back and provide those, but I didn't get credit for that. I didn't ask about meds or the onset of pain or radiation of pain. Um, but everything else looks like I did. So I guess I did okay talking to my patient. But now I had that feedback and had the opportunity to go back and redo my conversation.